The following is a project of our nonprofit newsroom. Support Midcoast Morning and local community-centered journalism today by signing up to be a monthly sustaining donor at choi.ca/donate. It doesn't take much money to support local news.
Hello and welcome to Midcoast Morning. I'm Joe Pugh. It's the final day for a pop-up overdose prevention site operating across the street from Nanaimo Regional General Hospital. Dr. Jess Wilder, a physician who works in addiction medicine at the hospital, is a member of the group Doctors for Safer Drug Policy, who are calling for BC to create sanctioned, fully staffed overdose prevention sites at BC hospitals. Wilder led the effort to create the unsanctioned, unfunded Nanaimo site, which was forced to relocate off of hospital grounds on Monday. There was also a pop-up site set up outside Royal Jubilee Hospital in Victoria, which was only planned to run until this past Wednesday. Overdose prevention sites are locations where people can use substances under the supervision of staff that can monitor for drug poisoning and respond to an overdose if needed. I visited the site Thursday to speak with the physician who set it up.
My name is Dr. Jess Wilder. I am a family and addictions medicine doctor here in Nanaimo, BC.
And we are sitting here across the street from NRGH at the pop-up overdose prevention site that you've set up. This got up here on Monday. We're now a few days on from that. How have things gone?
Yeah, thanks, Joe. Things have been going really well. We have had a surprising amount of people accessing our services, even just for it to be in its first few days. You know, usually overdose prevention sites take a little while to establish in a community before people who use substances recognize this as a safe place to come. And the amount that we've had as much utilization of it in just its first few days of existence is quite incredible and speaks to the obvious significant need here in this area of Nanaimo.
Now, just before we were doing this interview, someone came up and they said, what is this? What's going on here? I'm wondering two things. First, how common of an experience has that been in the days that you've been up here? And number two, what's the message that you give to anyone who comes by and is curious about what this is and how it works?
Mm-hmm. We have had a large number of community members, people who live in this neighborhood, people who are visiting family members in the hospital or who are on their nightly dog walks, stopping by, and I've been very impressed with how open-minded everyone has been. I think that we're realizing what we already expected, was that people have some knee-jerk responses and instinct reactions to the idea of people who use substances, but they lack access to accurate information and evidence about addiction as a medical disease. So people have stopped by and they ask questions about what we're doing. We provide them with some information. We answer those questions. We explain why this is a humane and evidence-based intervention that allows people to stay alive in a world of toxic drug poisoning. It allows people to stay here in the hospital, and a lot of people ask, is this the solution? And my answer to that is, no, this isn't the solution. This is part of a solution to buy time while we continue to figure out what we are going to do about this massive public health crisis. And it's something that allows someone to stay alive today so that we can continue working on this solution and figuring out how to support them tomorrow.
So when you share that message with people who come by, what has the reaction, what has the response been like?
We have had so many people express gratitude for providing them with the information, for providing our experiences as healthcare workers, working in an environment where we often are left without adequate tools to keep our patients safe. And it has been overwhelmingly supportive. People have really blown me away with their willingness to be open-minded and their willingness to consider the humanity of the community members who are often forgotten.
So you work in addictions medicine. You work, some of your that work is at NRGH. Can you explain to me the process of why you set this up and sort of what the logistic sides of having this going across the street from the hospital are?
Mm-hmm. So I know that one of VIHA's responses to not allowing us to set up on hospital grounds on Monday was that our hospitals already provide addictions medicine services and an addictions medicine consult service within the hospital who exists to support people who use substances who need to be admitted to access care. I am the physician lead for our addictions medicine service here at NRGH, and so I'm fully aware of the extent of the tools and the resources that we have to support people in our hospital. And I will say I'm absolutely privileged to be a part of a team of people who are as passionate, if not even more passionate, about this work than I am. Our addictions medicine team has a nurse, a doctor, a social worker, and multiple support workers who work tirelessly to create a safe and non-traumatizing hospital experience for people. And this service is new at NRGH. It's only existed for 6 years. Addictions medicine in general is still a very burgeoning field of healthcare. We have made some steps within our hospital and health authority in some right directions. The creation of our AMCS service is one example, but we still have a long ways to go. And this is just one of the many tools that I'm asking for as a physician to save my patients' lives.
Can you give me a sense of what does addictions medicine at the hospital actually look like? How do people interact with the system? How do they come to be seeking care? And what kind of care can they access? I would imagine someone doesn't just walk into the hospital admissions desk and say, hey, can I have help with addictions?
Mm-hmm. Well, sometimes they do. But the reality, Joe, is that people who use substances access the hospital for all of the same reasons that you or I do. They get sick, just like every human does. And they deserve to have access to this healthcare system just as much as anyone else. So as a doctor, it is not our place to judge somebody or decide whether the choices they make are right or wrong. It is our job to unanimously and objectively provide care and to keep people well.
Is the system doing that right now?
I think that there are many people within the system who are doing extremely well at that. And I think that our system as a whole still has been very slow to respond in this public health crisis. The reality is we should have absolutely every intervention that has been proven to reduce harms and save lives at our disposal as physicians. And we're still here fighting for even the most basic ones, such as an overdose prevention site.
So what kinds of things can you do now at the hospital? I'm just wondering, like, how do people who might be experiencing, say, addiction and then also some other health problem that maybe is the thing that they're coming into the hospital for treatment, like, how does that work? Where do you come into the scene?
Mm-hmm. First of all, thank you for asking that. I think that there's a huge misconception about what we do on our team. When somebody comes into the hospital, there's an entire spectrum of supports that I can provide them. Sometimes people come in for any myriad of reasons, and they, right then and there, want to make changes to their substance use. They want to apply to treatment centers. They want to get started on medications to stabilize their opioid use disorder. They want to get connected to community services and counseling and support groups, and we are able to do all of those things. If somebody is unsure of whether or not they're ready to change, but they want help to stay out of withdrawal and ensure that their pain and medication needs are addressed while they're in hospital receiving care, then we can provide some prescribed safer alternatives which can help to meet those needs, which can allow them to stay here. Finally, if people are not interested in making changes to their substance use, I meet them exactly where they're at. I provide them support. I work with them to create a care plan to make sure that their hospital stay can be as safe as possible. And we provide the education to allow them to use substances in the safest way that they can.
Is there anything you think it's important that people know about the substances that people are using or the supply of drugs in Nanaimo?
Yeah. We used to call this an overdose crisis. And overdose by definition means that someone has used a substance that they know, but they've used too much of it to cause harm. What we are actually in right now is a toxic drug poisoning crisis. So gone are the days where people could access heroin or other organic opioids. What we have right now is a illicit drug market that contains fentanyl, which is many times stronger than heroin or hydromorphone or morphine. And it is present in our drug supply in such high concentrations that it's incredibly lethal. Not only is there fentanyl in people's opioid drug supply, but we also are seeing contaminants like benzodiazepines, which are sedatives and respiratory depressants. We're seeing xylazine and dexmedetomidine, which are often used in veterinary medication to tranquilize large livestock. As soon as we as physicians are learning about the new contaminants and the new additions into the drug supply, there's something else that is added. And we are having a hard time keeping up in learning how to keep people safe in this ever-changing situation.
What do you need to be able to do that?
We need better research. We need better ability to test our drugs, better access for people to test their drugs, so that when we have something new that comes into our community, we can identify it fast and we can act fast to figure out the medical interventions that are needed to support people who are overdosing with those substances.
What was the process of having this OPS that's now across the street from the hospital? Was there a process of asking the hospital, the administrators, like, can we do this? Of you saying this is something we need on site? Like, what was that process like? So this was something that was initially announced by VIHA, actually, over a year ago, that they had plans to open pilot sites at 3 hospitals across the island, in Campbell River, Nanaimo, and at Royal Jubilee Hospital in Victoria. There was a working group that was making plans to open these sites and to figure out how that would look at each site to address each community's needs. And around the time that recriminalization was announced, the government shut down those working groups. And since then, it has been radio silence from our government about how and when we can restart that work. So it has been a long time. It's been 6 months of recriminalization and 6 months of that radio silence from our government. And meanwhile, every day, 8 British Columbians have died. So we waited patiently to have our health authority and our government figure out how to restart this work. When I brought up the idea of opening this overdose prevention site that is unsanctioned, it was not supported by VIHA. We were told that we were not allowed to set up on hospital grounds. And we, in response, moved across the street. So we're about 50 feet from where we initially planned to set up,
And we're still accessible to patients who are admitted. And we're having the support of nurses every day to bring patients to us to access this service.
Midcoast Morning is made possible by the Community Radio Fund of Canada and generous listeners like you. Support and grow our nonprofit newsroom project today at chly.ca/donate with a monthly or one-time donation. With your support, we can expand Midcoast Morning from 2 to 3 original programs per week to cover local news, current affairs, and arts and culture.
Today on the program, I'm speaking with Dr. Jessica Wilder. She works in addiction medicine at Nanaimo Regional General Hospital. Wilder led a group that started a pop-up overdose prevention site this week across the street from the hospital. It's unfunded and not sanctioned by Island Health. Can you tell me about maybe the staffing level here at the OPS and maybe just the support for this idea, this concept within the staff that you work with on your addictions team at NRGH?
I can say that we have overwhelming support from many staff members at the hospital. And I mean, as you've been sitting here with us, you've seen already many people who are coming by, who are staff members at our hospital, who are showing their support and bringing us warm drinks and snacks on this cold day. The support is there. And initially, unfortunately, VHA employees were scared to show up on Monday, despite their support, because they feared consequence to their jobs. I think that we all need to be held accountable for being a part of a system that makes people afraid to stand up for evidence-based care and for the interventions that they need to stay safe at their workplace, because they're afraid of retribution by their employers. That's a really disappointing thing to have heard as often as I did.
Do you think there has been a dichotomy presented in, I'll say maybe the general discourse or the media, that there is the idea that people can access treatment for addiction, i.e. they will no longer be using substances, and therefore something like an OPS would be preventing them from stopping using substances or somehow enabling them? Like, do you feel like that is a narrative that is predominant and exists out there?
Absolutely. That is the narrative that has been created. And I think there's been a reticence of physicians and experts in this field to speak publicly and passionately about our work. And that has left a gap in our society that has unfortunately been filled with the voices of people who actually don't understand this work at all, and who are having knee-jerk reactions to the idea of people using substances.
If that is a narrative that exists out there, well, what would you say is the reason why it maybe isn't the narrative you wish were dominant?
So right now, if somebody came to me, as somebody did, who is currently accessing our service here in this tent, and asked for a referral to treatment, I can fill out paper referrals to a treatment center and I can fax them to those treatment centers, and it will be months and months before my patient could actually access that service. In the state of this toxic drug supply, we have to be doing absolutely everything that we can to keep people alive today so that they can access those services tomorrow. And that is what harm reduction is about.
So is it really a matter of, like, if someone does walk into the hospital and says, hey, I'm experiencing serious addiction, I would like to stop, I would like you to help me do that, there are maybe services that exist that could hopefully help them do that, but they wouldn't be able to access them for weeks and months?
Yeah. And it's very devastating to me as a physician. It leaves me often feeling like I have failed my patients when they come to me and are ready to make changes. And there is often nothing that I can do today and right now to help them with that. We know in the addictions medicine world that capitalizing on those momentous periods of change that people experience when they're ready to go into treatment is of the utmost importance and is a huge contributor to their success in treatment. And so right now, with the lack of bed availability and access to treatment resources, we're leaving a lot of people feeling deserted.
It's been reported on that this week a person who had used services here after the site had closed died at NRGH. I'm wondering if you would be able to speak to me about that.
Yeah. This patient was really well known to me. I have provided care for him for years. And some of the nurses who are volunteering time to be at the OPS have known him for over a decade. This patient was really well known in our hospital and really loved. He had recently accessed housing. So obviously, as we see when people have housing and basic social determinants of health, he was not accessing the hospital as often as he previously was. But on Monday, he presented to the emergency department and was sick enough that he required admission to the hospital. While he was awaiting admission, he was supported by nurses in the emergency department to come to access our overdose prevention site. He spent some time with us here. Many of our nurses and healthcare workers who knew him were really happy to see him and reconnect. And we escorted him safely back to the emergency department before we closed that evening. Around 4 a.m., he needed to use substances to address his withdrawal and his pain, and he locked himself in a bathroom in the emergency department of NRGH. He died of a toxic drug poisoning. He was found by healthcare workers. Narcan was administered, and 20 minutes of CPR and resuscitation ensued, but it was too late. So this patient died in the very healthcare system and building that he went to and trusted to keep him safe and to help him be well. And this was an absolutely unnecessary death. This is exactly why we are here fighting for what we're fighting for. Because we know that when he had access to a safe place to use his substances, he used it. And he wanted to be as safe as possible. And when he was left with no other option, he locked himself behind a door.
Has that kind of thing been happening on an ongoing basis?
Yeah. Yeah, and that's why we're so... That is why so many of us here are fighting as hard as we are. Because we cannot keep coming to work and having to start our work days with taking a moment of silence for the people who died an unnecessary and preventable death. Not only are people overdosing and dying in our hospitals and on our hospital grounds, but people are overdosing and not being found in time, which was resulting in brain injuries that stay with these people for the rest of their lives and impact their ability to go about their days and function as human beings and citizens in our community. This is all preventable, and what we're doing here today is just one small part of all of the tools that we need to do that.
At the same time as this site went up at Royal Jubilee Hospital in Victoria, a similar one went up. Can you tell me about maybe the level of communication you've had with them and what you can tell us about how things have gone over there?
Mm-hmm. My colleagues in Victoria have had a much different experience than we've had here. We, on our first day here in Nanaimo, had the RCMP come and speak with me and say that as long as we were keeping people safe here, as long as we were monitoring them, that there would be nobody charged or arrested for public drug use. And they have kept that word. We haven't seen them. We haven't been bothered by anybody. Every interaction we've had has been really positive. And unfortunately, down in Victoria, they were also asked to move from hospital grounds. But basically, since then, they were accosted by police, fire department, all day, every day. They had only planned to run from Monday to Wednesday, so their last day was yesterday. but they were actually shut down prematurely by the Victoria Police Department. And in speaking with my colleagues down in Victoria, what they shared was that the police department said that they had to close the overdose prevention site portion of their demonstration, but they were allowed to be there in protest. And the reason behind that was that essentially these physicians would be aiding and abetting public drug use, and there would be criminal charges placed if they continued to run this service. So what I think is really important to acknowledge about that is that in Canada's history, the police's response to overdose prevention sites, sanctioned or unsanctioned, has been to recognize the importance of them in keeping communities and people safe. And there have not been arrests that have been made within an unsanctioned overdose prevention site. So this was a very new response from our police. I know that when our site in Victoria was interacting with RCMP, it was a much different tone, and they were very supported to run. So I'm not sure what spurred that very dramatic response from the Victoria PD, and it certainly is not something that there's any legal precedent for.
What are your plans for the future of this site?
We are going to keep going as planned. So our plans were to be here from Monday to Friday from 10 a.m. to 6 p.m. We're going to be here today, and we're going to be here tomorrow. And as part of our organization, Doctors for Safer Drug Policy, we plan to continue providing some positive disruption to our system to make sure that our government is aware that we are dissatisfied with the support that we are getting for people who use substances.
This week there was a new cabinet sworn in, a new session of government. We have a new health minister. Did that timing play into the timing of the site?
That was part of our strategy for when we chose to open, yes. We thought that our new Minister of Health might not have enough to do in her first week of work, and so we thought we would create a project for her. I would really love to be able to connect with our new Minister of Health and to discuss how we can bring sites like this to our hospitals.
Is there anything else you think it's important to share with the public about how the week has gone, what you're doing, or even just how they can engage with this issue?
Well, there are many things that you can do. We have already had many community citizens who live here by the hospital come by and share their gratitude for this service. These are community citizens who have had to respond to overdoses outside of their apartments or have found somebody unfortunately passed away in the bushes. And they recognize that a service like this will help to keep them and other community members safe. So what we are saying you can do is you can follow us on our social media, Doctors for Safer Drug Policy. There we have a link posted for a statement of support for this project for hospital overdose prevention sites. You can call your MLA. Writing a letter is always really nice, but calling and having them hear your words and your perspective directly is really valuable. And you can continue to stay curious and stay open-minded about things that you may not fully understand, and ask questions so that we can, as a community, continue to work towards finding a solution for this.
Dr. Jess Wilder, thank you so much for speaking with me.
Thanks, Joe.
Dr. Jessica Wilder is a physician at Nanaimo Regional General Hospital and a member of the group Doctors for Safer Drug Policy. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and RB Frew is our technical advisor. You can sign up for CHLY's newsletter at chly.ca/subscribe for updates from our nonprofit newsroom and more. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca. That's all for now. I'll talk to you on another Midcoast Morning.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHOI's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at choi.ca/donate. Finally, this program acknowledges and gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.